Hey everyone, I am Melanie Reynolds. I'm a nurse practitioner here at Empire Eye and Laser Center. I'm excited to talk with you about Dysport and filler, and I think they're two of the best treatments that we offer here. So I actually brought one of my best long time friends in with me because she over the years has asked me lots of questions and she's really good at kind of getting to the nitty gritty of things. And I thought that she would be a good person to ask the questions that you're probably at home thinking about. And we'll just kind of see what we can tell you today about the treatments that we offer. Also, again, just don't forget to submit your information on the chat window so that you be entered into the drawing for 30 units.
So I'm Lauren, and I've actually been a patient of Melanie's now for the past 4 years. And I have been injected with all of this good stuff. So, but especially when I first started, and even now, it's totally a learning experience. And I had all of these questions and continue to have questions too. So if you're ready, we can just get going.
Yeah.
All right. So, probably one of the first questions I had is, because everybody's heard of Botox before, it's kind of the most commonly talked about brand, but what is the main difference between the Dysport and Botox?
You're right that Botox is a very common brand that people are most familiar with. And oftentimes in the practice, we will call Dysport Botox, not to be misleading, but because we use it as a brand name like Q-tip or Kleenex. We all know those names. Dysport works the same as Botox, and it works to paralyze the muscles. So we get dynamic expression lines from raising our brows, or the 11s from furrowing in the middle. And when we relax those muscles with Botox, Dysport, or Xeomin, or even Nutox, which I think we can see, we can adjust the slide, we can see all the different brand names. But the main difference is just that the Dysport kicks in faster. So it is my preference. I can't go back a slide, I'm sorry. The Dysport is my favorite because it kicks in the fastest. So it's closest thing we get to instant gratification. Though they do all work the same, and we carry all of the products, and we can give somebody a preference if they have one. It's like I said, it's just our favorite one that we go to here in the practice.
So it kicks in faster, but it doesn't last the same amount of time as Botox?
You know, it really does. They both last 3 months. So does the Xeomin. The chemical itself is reabsorbed into the system after 3 months. And when you've been doing treatments for a long time, you may feel like you're somebody who gets longevity of your treatments longer than 3 months. That would just be your muscles having good muscle memory. And so the next slide I want to show you is a picture of a before and after photo. I'll need you to do it for me, I think. Oh, okay. So I picked this picture. This is a good friend of mine. He's a handsome fireman. Who doesn't want to look at a handsome fireman? But here's a great photo of him actually making the movement. And it's backwards. I think we can appreciate that Dysport did not actually make him worse. So the right photo is going to be his results of him furrowing to the middle and creating kind of the 11s. He's got a little bit of a 1. Some people have 3 of them. So it depends on how your muscles move, and we tailor and cater the treatment to your muscle movement. You can see on the left photo that was there how it looked before or after we did the treatment, and it's much more relaxed. The lines are relaxed. This is actually after only 1 treatment too, and so that line that you still see there in the middle afterwards likely will improve further with repeated treatments and keeping the muscles relaxed.
I think I was surprised to find out that the Dysport or Botox, it's not immediate. It takes a couple days to really see the full effects.
Yeah, so we say a couple days to kick in, up to 2 weeks to see the full effects. And so, you want to give yourself a little bit of time. If you have an event planned that you're trying to look fresh for, definitely need to plan accordingly.
So how much does this cost?
Okay, so when we talk about Dysport traditionally, it is priced a little bit differently than Botox and Xeomin. The hardest part is that that makes it difficult when we compare what you may have received in another office or a different brand of product. So we actually mix ours. They all come in powder form, and we mix it with a sterile saline. And obviously, we can't inject powder in the skin, so we've got to make it into an injectable form. And so we mix ours with a unique dilution that makes our units equivalent to Botox and to Xeomin. So we charge the same price across the board. You get the same effect across the board. If Dysport, if you ever see it advertised for half the amount, it's because they're using twice as much to get the same effect. So at checkout, you end up paying the same. We're definitely doing the same thing here, where your treatment results would be the same across the board. And so our regular pricing is $12 per unit. This week, up through Thursday, we have kind of a special discount going on. I think you can see it on the screen there. So new patients can buy into our kind of lower package for $10 per unit. You buy 40 to 74 units. And the idea is we're just encouraging patients to buy a package that would help them to be consistent. We wouldn't use 75 treatments in one sitting, but you would be buying essentially a year's worth if you do your math right and you know how many units you use per treatment.
I totally already took advantage of this plan. I called this morning. I didn't want to miss out on this because this is a great deal. And definitely once you start, you don't ever want to let it lapse. And so like for me, I'm pretty young, but both me and my mom and my stepdad and we've got everybody's coming to see Melanie now. And it's going to be different per each person. Of course, you want to have a consult, but how many units would you say on average you're going to use in a session?
Great question. And it is, like you said, it's going to be unique depending on the individual. But I would say typically for the forehead area, which would include the forehead and between the brows, arguably the most popular area that we treat is going to be about 20 to 30 units. Around the eyes, the crow's feet, second most popular area that we treat, 10 to 15 units is what I would recommend for there. And I also agreed that a consultation is important so we can kind of nail down how many units, but 30 to 40 units for the upper face is a good judge. There's certainly other areas that we can treat that take a little less units, like for the lines around the mouth, the barcode or smoker's lines, even when we've never smoked, the frown muscles, the chin dimpling. There's lots of unique things that we can do that I think if you were interested in, would warrant a consultation.
Yeah. And sometimes like I get feedback like from my grandma and stuff is that you're too young for all of that. But really it's preventative. It's so that, in like 10 or 15 years, I don't want a whole facelift because we're training my muscles, right?
Yes.
So
yes. And I would argue that too with a facelift. I have had patients that have said, I don't want to do something that would require every 3 months maintenance. When I'm ready, I'll just go get a facelift. A facelift does not actually stop your muscles from moving. And so it is not going to replace the need for Botox or Dysport because your muscles are still going to move. I mean, I hope they do. If they're not moving after a facelift, you probably went to the wrong surgeon.
Right. And so we did kind of touch on this, but you can expect it to last like about 3 months?
About 3 months, yeah. And I would say that your first treatment may feel like it wears off faster. If you've never had it before, your muscles are going to be at their strongest point. And so it's fine to come in early if you prefer to, but I would encourage that you stay on top of it at least for a year. Do it every 3 months. And then I think you'll notice that your muscles actually start to get better muscle memory. In fact, my next slide has a good photo of a patient, series of treatments. So in this middle photo, that was after her first treatment. And in the last photo, that was after a year of treatment. So after 4 treatments. So you can see that those lines just really started to improve. She had the same amount of units with each treatment, but she just had better consistency. I have 2 more slides. I'll quickly show you that show her muscles and different muscles moving. So the furrow muscles you can see are also lessened and dampened after even more treatments. And then same thing with her crow's feet.
And then I was so concerned about this, especially when I first came in, that, oh my God, it's going to hurt so bad. And you know about me that I'm the biggest baby ever. I have no pain tolerance whatsoever. I'm scared to death to be a mother one day, but really it's bearable. Is it uncomfortable? It's a little uncomfortable, yes, but it's totally bearable. And maybe you want to even show them like what you would use on me when I come in for my injections.
So honestly, this is Goldie. She's probably my best friend in the practice. All of my patients know who she is.
She's talking about this thing, not me. I'm Lauren. This is Goldie.
Oh yeah, this is my other best friend. So Goldie is just a vibrator or a buzzer. I hold it next to the injection site and it helps to distract from the discomfort. As silly and inappropriate as it might look, it serves a really good purpose to making your treatment comfortable, easy, tolerable as much as, it's a needle in the skin. So we are going to have some pinch that we feel, but everybody comes back for more because it's worth it.
Yeah, it's so quick. It's over over in just a few minutes, and it's so worth it. So even me, the biggest baby ever, I can take it. You can take it.
She totally can.
But this is something I was surprised to learn too, as a totally like fresh patient, never been in before a few years ago, is I assumed that everything you were using in my face was the same. You would use all Botox or Dysport, but actually I found out, no, there's a difference. There's actually filler and Dysport. So maybe we can talk a little bit about that.
Yeah. So filler, I want to talk about the anatomy of the skin aging. So we definitely don't only age by showing lines where our muscles have moved. And Sarah, if you can advance to the next slide, I think this is a good representation to show you what's happening underneath your skin. So these are the things, as your nurse practitioner, I'm very aware of all of these things happening underneath your skin. So I try to look at your skin more than just, skin deep. The muscles are moving, but we're also losing fat. We lose bone loss, and things shift and change, and gravity pulls down. And that's not to terrify you or scare you of the aging process. It just means that we have treatments that help to replace different aspects of the aging process. My new favorite thing I started saying a little while ago was we don't age in only one way. Like, for example, the sun is not the only thing that ages us. We have natural intrinsic aging, other types of extrinsic aging. And so we shouldn't try to anti-age in one way. Botox is one answer. Fillers help to replace those areas of volume loss. You can see the shift in the fat pads on her face. That's where we would notice the separation that would make us hollow in this area. Or we start to get some jowling down here. We get hollow back here behind the ear. Fillers help to anti-age in replacing those areas of volume loss. But it's also used to augment some things like the lips. We do age in the lips, and we develop those lines into the lips. They look a little bit like a deflated balloon. We also, when we don't have deflated balloons, may want an augmentation if we just weren't blessed with Angelina Jolie lips. So filler can be used for augmentation as well as anti-aging.
Yeah, which I'm well aware. I probably started doing just this, and Melanie's so conservative too. She will really ease you into that process. I started doing the lip filler earlier this year, and it's so natural looking, and it changes, like my face just looks so much more youthful because the lines in my lips are much more softened. And then I also put the fillers in my cheeks too, and it just kind of lifts my face. It pulls these lines out, it softens them a bunch. And so I love the fillers. I do the fillers and the Botox. So maybe we can talk a little bit about downtime, because for me, and especially now, I'm on Zoom all the time for my work. So maybe we want to talk about if somebody's going to have some of the dermal fillers, what that looks like.
Yeah, so downtime with fillers is really pretty easy. So different areas of the face, you're going to experience more swelling. Arguably, the lips are always going to be the worst. They're very vascular. They have a lot of blood flow to the area, so they're going to swell. I can't really prevent that. I will say if the masks come in handy for a reason, it is to hide the swelling.
I like this
really nice.
Yeah, I like this really just fresh lips.
And sometimes it's have fun with the swelling while it's there. It'll be gone in a couple of days, and then you'll wish you had more. The rest of the face, though, really there is no downtime. You may have mild swelling if we do the cheek area, very minimal if we do under the eyes. For the most part, people probably won't notice that you have swelling. You'll notice because you know your face, but it'll be pretty easy to honestly walk out the door and feel almost instantly refreshed. There is a possibility of bruising. I try really hard not to bruise, and I wish I had included the slide with the roadmap of the blood vessels in your face. I did not, but there's a lot of blood vessels in the face, and so we're going to try to avoid poking one and avoid bruising. I do the best that I can, but it's inevitable that it's a risk that we take.
I don't think I really had too much bruising even when I had my lips done, but it's pretty cinchy to cover up with a little tinted lip gloss or something. But and then there's no downtime with the Botox. I'll come in here and get my Botox and then be out the door with makeup on my face. After.
Right. It's just a matter of waiting for it to kick in to be able to appreciate the results. And of course, if there are any big events that we're planning for, we definitely want to plan your appointment time appropriately. I would always plan for the worst. Plan to be swollen and bruised and need to have 2 weeks for that bruising to go away before you would have your wedding or whatever event you may be having.
Yeah, definitely better safe than sorry. So maybe we can talk about the pricing for the fillers then, because that's totally different than the Botox.
Yes, it is. And also it lasts a different amount of time. Different fillers in the face have different G primes, which affects the kind of the heaviness of the filler. And so something that we want in the cheeks, so we just want to have a little bit more staying power, is going to have a higher G prime than something we put into the lips or around the mouth. We want those to be flexible and move and with the tissue as we laugh, talk, and eat. And so our fillers are almost all priced the same. They're $6.50. Do you want to advance to the price slide for me? I'll come back to this one. Oh, I'm going to advance ahead then to pricing, and we'll scroll back. So for the event, the regular price again is $6.50. You know, the more you buy, the more you save. And $5.75 obviously for the first syringe. Now we can use this in a way that we treat different areas, and you can buy multiple syringes. We can do them in the same day. You can plan ahead that, you know, the lips are only going to last about 6 to 9 months. The newest filler in the market says 9 to 12. So we'll I've been using it since May and I love it, but I haven't had it in my hands for 9 to 12 months. But you may buy a couple syringes that you use throughout the year to replace the volume as you lose it. But I do want to talk about the different types of fillers. The Restylane brand of fillers is my favorite to use here in the practice. It's a hyaluronic acid based filler, which is a natural sugar molecule that our body makes, and it's just generated in the lab with that different like G prime and thickness. And so, you know, you don't really need to know what filler to purchase for different areas of the face. You just would buy the pricing of the filler, and when you come in for your consultation, we can pick what we want to use at that time. Sculptra is a very different type of treatment that actually stimulates your body to create its own collagen. And I encourage you to stick around for the next talk. My colleague Rachel is going to be talking about Sculptra, and it's a really beautiful treatment and different in and of itself. But if we're looking at some different areas, I realize those were the next slides that we kind of skipped ahead on. I wanted to show you a few before and after photos of patients of mine. I have lots on my Instagram that you can go on and see. I think this is a beautiful photo of a lip augmentation. I mean, this is immediately after. You can see one little needle poke of blood. I wish I could say I did all that with one needle poke, but I just got lucky the rest of it you couldn't see. We numb when we do lip treatments, so it's tolerable. In this picture, we actually did the cheeks. So also immediately after, that's why she's a little rosy in her cheeks. But if you can appreciate how much more lifted her face appears, it's subtle but dramatic.
I love the cheeks.
Yeah.
It makes such a difference. Like, especially in these laugh lines right here. What do you call these?
These are called the nasolabial folds. And I do oftentimes have patients come in that say, I want this filled. It's really deep. Well, this, it was you. This area is a symptom of our cheek falling down. So if we can lift and pick up the cheek, that might be all we need to help soften this. And we also want to keep in mind somebody's natural anatomy. I just have naturally deep folds. My children have them. So I have to understand where I want to balance the aging aspect and picking up the folds versus what should be there with my facial structure.
That's one thing like I love so much about coming to see you is you totally are, you're conservative. You really want my face to look like me. And, you know, unless I give you some insane direction, but very cautious. And so you can really ease into, you know, using a filler product or Botox product.
Yeah. Another popular area to treat on the next slide is the under eyes. We often will feel tired and hollow and, you know, make it, even when we're not tired, feel like we look tired. This is a popular area to put filler. I will touch on this now. The pricing is listed later, but this filler for the under eyes that I use is actually the original filler that was released because it's been around the longest. It's priced cheaper. It's cheaper for us, therefore it's cheaper for you. So it's priced at $5.50 normally. We do have a package that kind of caters to this that includes Dysport for around the eyes for the crow's feet, the under eye filler, as well as a brow growth serum that actually works pretty well with a nice brow gel. And that package is priced at $6.50. So you kind of get all those extra bonuses for a really discounted price. And then, you know, when we also talk about anti-aging, we talk about, I've already mentioned it, combination therapy. So we shouldn't be just doing one thing. On the next slide, we've got a good photo of a patient who had Botox and filler to the lower face area. And if you just take away the red arrows and the blue X's, you can appreciate how much improved she looks. The blue X's are areas that I had done Dysport. So we relaxed the muscle movement of the chin for the dimpling, the muscles that help or that pull the corners of the mouth down. When we relax those muscles, it lifts the corners of the mouth. We also did filler to her lips, some fillers to her folds in here. And I think this is a really excellent, youthful, refreshed look that still looks like the patient. She doesn't look different or weird or unnatural.
Yeah, this is definitely it's subtle, but it makes such a difference, especially when you're doing like multiple things like that. Your face just ends up looking refreshed. You look well rested and healthy, and it's good.
Yeah. So I have a couple other pricing packages I want to mention. We already saw that Sculptra, we can treat the body and do a nice augmentation for the booty. We can also treat to help with the skin texture of the arms and the legs. These are areas that as we have more birthdays, we need to start considering. But Rachel will go into that more as well. And then the next slide talks about for the face, which is priced differently because we need less when we're not doing such a big augmentation. Again, stick around and she'll go over what that means or what, how many vials that you should plan for. Some of our packages that we have are the Bright Eyes package. So this shows you everything that's included with that. Oh, I forgot to mention it has a photofacial, which I don't know that we have a sit and sit for photofacials this week, but I know that, that treatment is beautiful for helping to even out the skin tone, help diminish pigmentation and redness. And it's, a type of similar to a laser treatment with no downtime. So that's a nice bonus in there for that price. And then our Luscious Lips package. This one has the lip filler, a little bit of a lip flip, which would help to open up the top lip, or the perioral lip relaxation, which just means we can help treat those barcode lines. And then microneedling. Microneedling is a treatment we'll talk about on Wednesday that helps to, stimulate healing and repair of our collagen. So this is also a nice package.
Yeah, definitely get in with these special deals because once you start, you are not going to want to stop.
And then our gifts with purchase. Also, if you're going to be buying some things, I wanted you guys to know what's available as just a really nice bonus, for buying something you're already planning on getting anyways. And then I think that's it, unless you think there's more questions or if you guys have any questions.
I will say, I use all of the Zoe products, and you got me on the Jane Iredale stuff, and they're all fantastic products too. So that's a great bonus for, just, spending preemptively, taking care of it preemptively. But maybe some of the people tuning in have some questions.
Yes, we have some great questions. So what is the proper process for a lip filler, and what should the patient do to help maintain it?
Okay, so proper process. I don't know if I'll answer that correctly. If I don't touch on what you need me to, then ask it maybe in a different way. But essentially, when you come in for your appointment, we're going to put some numbing medicine on. We'll definitely take some before and after photos. I prefer to do the lips over 2 visits because they are very vascular, as I mentioned earlier, and they start to swell right away. So sometimes it's hard to evaluate what the final outcome will be. So I prefer to do a little bit into the lip, get them to where we think we're happy with them when we love them. It might take half a syringe or 3/4 of a syringe. Everybody's lip's going to be different, but get them to where we think we're happy with them. Let you go home and live with them. The swelling come down, let them heal. When you come back 2 weeks later, we can say, are we happy with them? Do we actually miss the swelling? And then, we can determine then what to do with the rest of the filler, whether we put it into the lips to give us more back to the swelling look that we had, or if we want to find another area on the face to use the rest of the filler. We definitely don't let it go to waste. And then I encourage patients afterwards to ice it a lot. The more you ice, the faster the swelling comes down. Try not to use the lips. And so I would encourage patients not to smoke or drink through a straw or drink through a bottle. We don't want to pucker when we're icing or touching the lips, to be gentle. It's okay to use lip gloss, but maybe not lip stain, since that requires more rubbing and being vigorous to rub it off. So that's what I would say for the process. And how to maintain the lips would be really to try not to use the lips in that initial period so we don't move them around. Everybody's body is going to have different metabolism rates, so there's not a set in stone answer about how long it's going to last for each individual.
Our next question is, does the Dysport have some of the relieving effects for sinus relief like Botox does?
They all work the same. So yeah, you would achieve those effects with Botox, Xeomin, or Dysport.
Can you get Botox or fillers right before a surgical procedure?
I would not. And I guess it would depend what type of surgical procedure we're talking about. I mean, I obviously work with an eyelid plastic surgeon, so when we do Botox and we lift the brows, that might affect how he would want to do the surgery. So we just would want to make sure that our treatment is not in the middle of going into effect at the time of the treatment. If you were having any other surgical procedure, I would just say give it 2 weeks so that it's kicked in, it's in your system, you're good to go. It doesn't go systemically, meaning it stays local at the muscle of where we treat. It doesn't go into the blood system or travel throughout the body. So there's really no risks or side effects associated with it. Very, very, very rare.
Okay.
Yeah.
So next, we're ready to announce our winner. I believe we have one last one. Oh, we have one last question coming in before we announce our winner. Can you do radio frequency treatments after treatment?
Again, I would wait 2 weeks just so that it's kicked in and we're not messing with the Botox and possibly moving it around to a different part of the muscle that we didn't want to be relaxed, but absolutely it's fine to do.
All right, we're ready to announce our winner now.
Oh, I'm excited. All right, Veronica Salcido, looks like you're getting a treatment. And I'm excited to give you 30 units will be a good amount to treat the forehead, possibly around the eyes. So we'll call you, contact you with some instructions and get you scheduled for an appointment.
It's your lucky day.
It's your lucky day. Yes, and please stick